Friends, sorry for that. There was a technical glitch. And I had to take care of the problem. So we are talking about something that is important. We are talking about something that is important. And it's important to talk about these things. Check about this one. Yes, sorry about that. We are talking about why antibiotics are prescription-only medication, and something came up. I had to go and work on it. So we can continue for some time. It is 7. I think today we are so late. Sometimes you can start something and then you get some technical hitch. Then you go to work on that thing. So let's about why antibiotics are. Let's check. We talk about today. There are so many confusions. You start this, then something else comes up. Or the power hitch, now there is camera hitches, but we will continue just like that. Flow with Karin. I can see Flow with Karin here. Flow with Karin, I met you on which channel? There was a channel that I saw you. I think it is a Barry Walking Exercise channel. I think it is that channel, yes. Flow with Karin. Welcome, Flow with Karin. We were talking about why antibiotics are not over the counter, and then there was a technical hitch that I had to go and work on. I had to go and work on. So if you are coming and you are a new person to the channel, it's your chance. You can like and subscribe to the channel and come to the chat also. Yes, then I subscribed. Oh, nice. Then we talk about these things. So today we are talking about why antibiotics are not over the counter. They are prescription only medication. You know, antibiotics can mess you up. Every time you feel like you have a flu, you run for an antibiotic. Every time you feel that you have something that is working on you like a cough, you go for an antibiotic. It is very dangerous. You stop taking antibiotics anyhow. You will mess up yourself. You will mess up yourself. So today I am a nurse. Oh, Flow with Karin. A nurse working in which state or country? Which state or country are you working on? I like it when medical health workers come on my channel because I feel good. They can help me answer some questions that some people are asking in the chat. New York. Nice. Flow with Karin is in New York working as a nurse. So if someone asks me a question that you can answer on the chat, you come in and take cover. You take cover. So that is it, my people. We talk about why antibiotics are not over the counter. You know, they prevent when you only take prescription from a doctor of antibiotic. It is against you have to have a diagnosis. Antibiotics are controlled medicine in many places because they need to be used carefully and prevent harm to the individual and the community. Yeah? However, the exact legal classifications differs by country. Many antibiotics are prescription only, rather than controlled drugs in the same sense as opioids. There we have many classes of antibiotic. We have many classes of antibiotic, and these classes can mess you up. I said, antibiotics are given considering several things like penicillins. Let me go through the classes of antibiotics. You have penicillins, cephalosporins, macrolides, aminoglycosides, fluoroquinolones, sulfonamides, glycopeptides, glycosamides, oxalizodines, and then we have rifampicins, carbamazepines, all those, chlorophenicals. Around 16 to 20 types of classes of antibiotic. And we don't just give antibiotic to someone. No. There are some antibiotics that work by destroying DNA. There are some antibiotics that work by destroying the cell wall. There are some antibiotics that work on aerobic bacteria that need oxygen to survive. There are antibiotics that work on those bacteria that don't use oxygen to survive. So when you give someone antibiotics, you consider all these things. I don't know one thing about bacteria. When you start to fight them, they start fighting back. They start forming a fighting mechanism so that they can, they can overcome you. When someone comes to fight you, or someone wants to put you down, you fight back. When soldiers go and attack a camp of other soldiers or a country, other soldiers come out to fight that person. So it is important, when you're taking antibiotics, to consider the things that I've said. One, let me talk about it. Some bacteria work on the cell wall, some bacteria work on the DNA of the bacteria. Some bacteria are called bactericidal. They just kill the bacteria. Some antibiotics, they just kill the bacteria. And when we are giving the antibiotics to a person, there are some things we consider that are very helpful and important. One of the things that we consider when giving antibiotic is called two of the things. First, pharmacodynamism and pharmacokinetism. These two are very important. Why? Because pharmacokinetism and pharmacodynamism tells us how the antibiotic will work on your body as it is killing the bacteria. Two, it tells us how your body will react to the bacteria itself. And all these things are what the doctor has learned. And from that, we talk about something that is important, very important. What is this thing? Bioavailability. How much of the drug will you take for you to heal? How much of the drug will be in your body before it is excreted? How much will be destroyed? Half of the drug will be destroyed within a certain time. It is called half-life, within a certain time. We will usually say about 8 hours or 8 hours or 24 hours. Every drug has got its own bioavailability. You see things that we consider. And then we take and we check these antibiotics that we are giving this person. What is the therapeutic index? And what do you think therapeutic index is? Therapeutic index is something that is so important in giving medication. Therapeutic index says, let me use a very funny word. Which percentage can that drug kill you? That is the way I can put it. Therapeutic index. the toxicity of the drug. You see, the toxicity of the drug. The toxicity of the drug. You see, the things that we consider when we are giving antibiotics. There are so many things we consider. These are the things that we consider when we are giving antibiotics. Therapeutic index is the measure of drug safety. It compares the dose cause toxicity with the dose that produce the desired therapeutic index. The dose that can give toxicity to your body and the amount of drug that is needed to make you be better. Those are things, a therapeutic index. That is the thing that we look at. So when you ask a doctor, why have you given me this antibiotic and not this one? You know the considerations that we take now. Why are you giving this antibiotic and you are not giving me this antibiotic? There are some things that that doctor has looked upon and has said, now you have a respiratory a disease, you have pneumonia. Most of the pneumonia, I'm giving a classical example. Most of the pneumonia respiratory bacteria, they use oxygen. So I will take aerobic and a drug that can kill a bacteria that use oxygen, aerobic bacteria. Second, I'll check on the dose of this person. Is it 500 milligrams? And what is the therapeutic index? What is the therapeutic index of that drug that I'm giving? And we have said therapeutic index is the measure of the drug safety. It compares the dose that can cause toxicity. Yes, Agnes Thomas and TPK Love, welcome to the chat. And they compare the desired therapeutic effect. Therapeutic effect means how much of the milligrams that I'm giving you that will make you feel better. So toxicity plus the one that can make you feel better. Then after looking at that, for how long, the distribution, for how long should I give you that medication, this antibiotic, so that you can be okay. You see things, greetings all my life. Oh, okay. You see things that we consider when we are talking about antibiotics. Some people that have destroyed themselves big time because of taking antibiotics without any regard of all this. And there are some health workers also that have given antibiotics without regard of anything. You're just giving people antibiotics without thinking of the dosage. Is it the bacteria aerobic or anaerobic? You see those things. A classical case is when someone is given, you have anaerobic bacteria that use oxygen, and then you are given antibiotic that it kills a bacteria that is aerobic. It won't work. You will take the antibiotics. That's why sometimes you go back to hospitals and you say, I was given antibiotics and they are not working. And these antibiotics are not working. Agnes Thomas, greetings everyone. Thanks everyone for coming in. So there are some points and tips that people should know, when it comes to antibiotics therapy. And why antibiotics are called only prescription medication. Let's talk about prevent antibiotic resistance. And that's what I was saying. You see, when you give someone antibiotics, unnecessary use allows the bacteria to develop resistance. The bacteria starts to learn how to fight that, because today you take the dose, tomorrow you feel better, you stop. After 2 days, you start feeling the symptoms. You again start doing what someone is calling fall without thinking. Okay, let's continue. Sejak flow with Karin, TPY, flow with Karin. Welcome everyone. Now, let's continue, my friends. You should check on prevent antibiotic resistance. What is resistance? Resistance is, we continue now. There is a bit of communication. People are getting in and getting out every time. Now, we were talking about antibiotic resistance. Today, you are given medication. Symptoms go. You feel like you are okay. Now, the bacteria starts to learn how to protect itself from the drug that you are using. You see, the bacteria starts to learn on how to fight that bacteria, that drug that you are using. The next time you will be very sick and you use the same medication, because the bacteria have attained resistance, the bacteria will not die. We have to go to a higher dose, or get another way to do what? To treat you. That is controlled. We control these medications, and we give prescriptions because of this, and we advise about antibiotics because of this. Ensure the correct antibiotic is chosen. And I've said to ensure that the correct antibiotic is chosen, what do we do? To ensure the correct antibiotic is chosen, what do? We check on pharmacokinetism, pharmacodynamism. We have said those bioavailability of the drug, therapeutic index, the kind of bacteria that we are dealing with. Is it respiratory? Is it systemic? You see, there are so many things. This point is very important. Ensure the correct antibiotic is chosen. Ensure the correct antibiotic is chosen. That is why we give prescription. You don't just buy amoxil or cefuroxime because it worked well last time. Let's go through the things we check on before you give antibiotic. Pharmacokinetism, pharmacodynamism, bioavailability of the drug, half-life of the drug, dosage, distribution. Just imagine all those things. Milligrams, age of the patient, the bacteria that is in case of the diagnosis. Is it aerobic, anaerobic, and for how long are you going to take the medication? Those are 10 things that a doctor looks at and says, give this is the right. And so it entails some clinical examination, medical examination, lab works, laboratory works, thinking, and also choosing the right antibiotic. So that is why we give it as a prescription. Ensure the correct antibiotic is chosen. See that? Very important. Correct diagnosis is important. Correct diagnosis is important. Antibiotics treat bacteria, not viral infections. Don't give antibiotics to a viral infection unless you are giving as a prophylaxis of something that you think it will come to happen. And this issue of giving antibiotics as a prophylaxis is not okay. And then we give it because we give prescription to avoid misuse of antibiotics. People may take antibiotics for cold and flu or other conditions they don't work. Imagine you have a viral flu and then you're given antibiotics. Very important. Antibiotics should be protected by law to avoid resistance. I asked one patient who was being treated by a medical worker, imagine if you are given a wrong antibiotic and you have TB, and then the antibiotics they gain resistance against anti-TBs. What will treat you next? If anti-TBs, people with TBs, they use more than rifampicin, isoniazid, pyrazinamide, and salbutamol. Imagine they use for antibiotic rifampicin, isoniazid, and salbutamol, and those are how many? Isoniazid. And then you gain resistance against those antibiotics. What next will treat you? Resistance is very bad. That's why we give prescription. We give prescription so that you cannot get half. And I will have treatment, incomplete medication. And I'll tell the people that are in pharmacies, people that are working on the medical sector, it is very important not always give a patient full dose. If you don't have full dose and you are working in a pharmacy, if you don't have full dose and you are working in a pharmacy, you should do what? Go and refer the patient to where he can a full dose. If you don't have it, don't sell drugs, treat people. Or if you don't have full dose, go to the next supplier or a pharmacy, get the full dose for this patient. This patient has a prescription, let the patient get a full dose. Prevent incomplete treatment is a very good part of treatment. Stopping treatment incorrectly can contribute to treatment failure and resistance. Reduce serious side effects. Serious side effects. Antibiotics can give you serious side effects, my friend. Let me tell you that. Antibiotics can give you serious side effects. And why do we say so? You have seen some people that have got serious rashes. You have seen some people that have got serious problems when they use antibiotics. So let's get the culture, adapt the culture of getting prescriptions when we are getting antibiotics. You see, prevent allergic reaction. There are some people that are allergic to some antibiotics. There are some people that are allergic to some antibiotics. You give a person who is allergic to sulfur, something like septrin, that person will be back in hospital with serious problem. Some of them even can be fatal. Some of them can be even fatal. Consider pregnancy and breastfeeding. Some antibiotics are unsuitable in these circumstances. You have had some people that are told, you are pregnant, you cannot take this drug because they are teratogenic. They destroy the growing fetus and the growing young. So these are if you are pregnant, make that always go to hospital to get a prescription, because we don't want to get problems when children are young. You see. So when you are pregnant and you are breastfeeding, there are some antibiotics that are not considered well for children. Hi bro, like Dan 5. All of you invite my channel. Nadine, okay, Nadine is saying we go to his channel. No worries. You see, those are the problems that we prevent. Very important to avoid drug interactions. There are some people that are using some other kind of drug that can interact with what you are taking. So what do? You give this person a drug according to the drug that he is taking. Now, that is another point, number 11. After the 10 points that we have named, you check if this person has another drug that is using, like which drugs. This person might be using something like This person might be using something like, let me say, this person might be using something like antihypertensives, antidiabetics, these drugs, like such drugs. This person might be using such drugs. And then you give a person a drug that is interacting with the diuretic, antibiotics that interact with the diuretic, like furosemide. It will not work. It may cause problems, more problems to this person. So we should check on this. Protect normal bacteria, normal body bacteria. Protect normal body bacteria. When you are just taking antibiotics, always when you are sick, you rush to a pharmacy, you get antibiotics. When you are sick, you rush to a drug dispensing chemist, you buy antibiotics. Do you know what you are doing? This body of ours, they have some good bacteria that help you to destroy some other bad things that may enter your body. Then you, because you know well, anything that comes out, you want to rush and take antibiotics. And you take them for so long. You can take them even for more than 1 week. You are destroying, and that's why some women, when they are using some antibiotics, you will start hearing them when they are going to the loo, to relieve themselves. You will hear them saying, I'm having a burning sensation. Why? Because you have destroyed the good bacteria. You have destroyed the good bacteria. You see? Those are the things that we check, and we say that we should not be using bacteria unnecessary. You see, my guys, it is very important to consider these things. If you have a question and you're just coming in right now, please put up that question. Let's hear about what you say. Let's hear about what you say. Now we have other issues like prevent allergic reactions. That one we have said. Avoiding drug interaction. Consider pregnancy and breastfeeding. Protect normal body bacteria. I've explained. Now you know you have a good bacteria that helps you. You have a good bacteria that helps you. Now let's talk about some other issues that are important also in antibacterials, like prevent Clostridioides difficile infection. And antibiotics exposure can increase the risk of severe antibiotic associated with diarrhea. It is called Clostridioides difficile infection. You take antibiotics and then you start having a diarrhea, very bad diarrhea. You see, antibiotics can make you be bad, my friend. Antibiotics can make you be so bad. You check this out. So let's talk about these issues. And don't just take bacteria. Get a prescription. Have you ever got an infection and then you use a bacteria and then you start having a diarrhea? That is it. And then you may also reduce unnecessary health cost. Today you come here, you get a resistance of this bacteria. Tomorrow you go get another one, you get a resistance of that bacteria. How do you think you'll go to more expensive antibiotics? You'll get more expensive antibiotics, and that one will be a problem. So you prevent the cost of antibiotics that you are using, and also prevent treatment failure, because when you're giving a prescription, you're targeting what unnecessary broad spectrum antibiotic use. You know, you are using a broad spectrum antibiotics and getting their resistance. Laboratory testing may be necessary when you are using antibiotics. Prevent antibiotics sharing. Promote antimicrobial stewardship. That is why we always go to a pharmacy, then a farm tech will tell you, please go and super live. Hi, there is something wrong with my phone. It's not updating messages. Okay, no problem. Ravi was here. Ravi, big up yourself. Big up yourself. Big up yourself, Ravi. Big up yourself, everyone who is coming. So those are the points that we look on when we do what? We choose an antibiotic. We choose an antibiotic. So, okay. Let me check this one. So, anyone who has a question today, it has been a short. It has been a short talk, and let's meet tomorrow. There have been so many confusions today. That's why I have not been online for long, but I think today will be okay. So everyone who is watching, nice time. See you tomorrow.